It's time for a Wellness Revolution. Brought to you by Hotze Health and Wellness Center. Honest discussion on maintaining health and wellness naturally to enjoy a better quality of life.
He's the doctor fighting to let you keep your doctorate.
Now, Dr. Stephen Hotze.
Welcome to Dr. Hotze's Wellness Revolution. I'm Stacey Banfield here with Dr. Stephen Hotze, founder of the Hotze Health and Wellness Center. And today we've got a great guest, Sheldon. She's got a fascinating health success story, especially since her problem started very early at a time when people should be thriving. She was really suffering. So Dr. Hotze, why don't you share with us Sherry's story?
Thank you, Stacey, and thank each one of you for joining us today on Dr. Hotze's Wellness Revolution. You know, I believe that you and everybody really needs a physician and a staff of professionals who can coach you on a path of health and wellness naturally. So as you mature, you got energy, vitality, and enthusiasm for life. We have a wonderful guest today, Sheldon. And Sherry's been a guest of ours at the Hotze Health and Wellness Center for nearly 20 years. She came here in 2001, and she has a most remarkable story. It's really tremendous. And I saw her first when she came in. I was still seeing patients actively at the time, and I was the only doctor on our staff at the time, and I had the opportunity to meet with Sherry then. So, Sherry, you came in back when you were 49 years old, back in 2001. And tell us what had been going on in your life over the past 20 to 30 years that ultimately brought you into the Hotze Health and Wellness Center.
Well, I had a lot of symptoms. I had decreased energy level and a lot of swelling face and hands, and always cold hands and feet. And I had gained weight that I couldn't lose.
How much weight did you gain?
Oh, it was like 40 to 50 pounds. It was quite a bit, and it was always a struggle, and felt depressed a lot, blue, and discouraged. I had lost kind of my zest for life and my joy, and I had muscle weakness, insomnia, and would try to sleep 8 or 9 hours, but did not wake up feeling refreshed like you should if you had that much sleep. So that's pretty much.
So this all started 20 years before when you underwent a hysterectomy at age 29. Now,
yes.
That is very young for a woman to have a hysterectomy. So what kind of symptoms what kind of symptoms did you have that would lead a gynecologist to perform a hysterectomy on you?
Well, I was having a period like every 2 weeks, and it was extremely heavy and cramping, and I believe, just now I know it was hormonal. It was just up and down in my feelings, and my libido was not good.
Now, this is at 29. At 29, you ought to be feeling like $1 million.
Right.
And if you're having problems with your menstrual cycle, like Sherry did, dysfunctional uterine bleeding, breakthrough bleeding, periods that are coming quickly, they're heavier. Normally they're 3 to 5 days, and they go 5 to 7, 7 to 9. Now you get cramping, and then you get breakthrough bleeding and clotting, and you get mood swings, fluid retention, weight gain, breast tenderness, headaches, and all these things are happening. That is an indication that your hormones are imbalanced, and this happens. The problem is not that you have an abnormal uterus. Your uterus is being taxed and trained to do what it does by the hormones. The hormones are what makes the uterus develop and bulk up for a pregnancy, and then get matured and then have a mature lining of the womb for a pregnancy as you balance your estrogen and progesterone hormones. And when a woman has dysfunctional uterine bleeding and cramping and all the symptoms that Sherry had, that's a classical feature of low progesterone and estrogen dominance. I wrote about it in my book, Hormones, Health, and Happiness. The chapter's entitled Estrogen Dominance. It can be easily corrected if you take natural progesterone day 15 through 28 of your menstrual cycle, which her doctor could have done for her at that time. But remember, most OB-GYN doctors don't view things the same way as a doctor that takes his natural approach to health. So OB-GYN doctors are surgeons. They perform deliveries, cesarean sections in the first half of their career. The second half of the career, they make their living doing hysterectomies. Chance to cut, chance to cure. They can stop the bleeding, but the bleeding isn't the problem. That's a symptom of the underlying hormonal problem that existed in Sherry's body, for which the doctor did a hysterectomy. And then, of course, he put you on Premarin, Provera, a host of very estrogen products over the next 20 years, right?
Right.
And that's when you developed all these symptoms.
Yes.
Low energy. You came in here, your energy on a scale of 0 to 10, 10 being brimming with energy. When you came in 2001, what was your energy level?
Oh, gee, I probably a 2 or a 3.
Well, you rated it a 1.
Did I do? I don't remember.
A 1 out of 10.
10.
Anyway, it was mighty low. You'd had difficulty with weight. You weren't able to think clearly.
No.
You had joint and muscle aches and pains. You had insomnia, loss of romantic moods and inclinations. Moods were down, gained a ton of weight, and just felt sick and tired all the time, right?
Right.
Okay. So here you are rocking along 20 years later feeling like death warmed over, right?
Yes.
How did you hear about us?
Well, actually, was one of those days I needed to get out of the house because my husband said, we're going to go for a ride in the country to kind of cheer me up and quit looking at the four walls. So as we were driving along and we stopped for gas and we're listening to the radio, the talk radio, the show that you were on, and you were interviewing a lady that had similar situation as mine, and she was lamenting all the different symptoms and problems, and I'm thinking, wow, that lady sounds just like me. And I hadn't thought that thought for just 1 second, and my husband says, wow, she sounds just like you. So my husband said, well, let's look into this. Let's check with, we're going to call Dr. Hotze. We're going to call and see and see if we can't get some help. And that's how we got started with you.
Okay, so you came in, and I had the opportunity to be the first one to see you, didn't I?
Absolutely. Yes. It was wonderful.
It was a great day for me, too. So tell me, how did the visit go, the first visit? What was it like when you came in? You'd seen several other doctors, obviously, over the last 20 years trying to get on path, right?
Yes. Well, you walk in, and immediately you're called a guest. And the hospitality at Hotze there's bar none. There's no one that does it as well as you do and your staff. They're wonderful, wonderful, wonderful people, and came in and treated me like a queen and showed me to the room, and you came in, and you looked me in the eye. You had compassion, you had understanding, you asked me the right questions, and this is the way that doctors should be with their patients. This is the way that doctors should put you. I was completely at ease. I felt finally I'm here where somebody is understanding what I'm going through.
So we got you started that day, got you up. You had all the signs and symptoms of low thyroid, and your hormones had been totally whacked because they did a hysterectomy and took out your ovaries. So we replenished you with natural progesterone, some natural bias, natural female hormone, put you on some put you on some thyroid medication at the time, got you on some vitamins and minerals, got you on a good healthy eating program, and exercise. That was pretty much it. How long did it take you before you began to feel like you made a turn?
Well, actually, I don't think it took that long. That it was 20 years ago. Almost.
So it's hard to remember.
So I've slept since then, as the saying goes. But it didn't take long. I just know. I'm sure that probably within just a few weeks, I started to respond. I felt like I could feel just some vitality flowing back and my energy coming back. The fatigue wasn't ruling my life. And I could think again, and joy was returning.
Husband tell a difference?
Oh, yeah. Absolutely. Yeah, that's what. He was really happy that we came to see you, Dr. Hotze.
Listen, and I know, remember, you questioned when you first heard about it, you said, well, I'm afraid this is going to cost us some money, right?
Right, right.
And I like to tell people, what in the world is your health worth?
Exactly.
Do you want to go living a life where you're sick and tired every day, you're depressed, you're overweight, you can't think clearly, you got no romantic moods and inclinations, you ache, you go to the doctor, they've got on antidepressants, sleep medication, anti-anxiety medication, anti-inflammatory medication, you name it, they got you on all kind of anti-medication for anything and everything, and you feel like death warmed over, and you call that getting well? That's not getting well.
No.
That all that is just maintaining a sick state, masking symptoms, and they don't even mask the symptoms well.
No.
The most important investment a person can make, which Sherry made, is invest in your health. You get your life back. What's your life worth? So that's what we do here at the Hotze Health and Wellness Center. We help people get their life back, and we help Sherry's husband get his wife back. Huh?
Right, that's right. And
Now, I know a couple of years back, then all of a sudden you felt like you were kind of deteriorating, and you were having some symptoms, and you went to the doctor, and we diagnosed you had some Epstein-Barr,
right.
which many people have. Epstein-Barr virus is old kissing disease, okay, mononucleosis. You see it in kids in high school. Almost everybody in the American public, if you draw antibodies, is going to have been exposed to Epstein-Barr. Does that mean you had mono? No, not necessarily. But in some people, it will flare up for some reason or another. And so Dr. Ellsworth got you under treatment using some low-dose naltrexone.
That's right.
And tell me about that.
Well, that has been. Well, I'm going to back up just a little bit.
Okay.
When I see Debbie when I come in.
Oh, that's right. You saw Debbie.
I saw Debbie, and this last year, then she told me that I'm going to put in a plug for your IV drips.
Right.
The vitamin C has helped me a lot with the symptoms with the Epstein-Barr. The Epstein-Barr, I'm gonna go back one thing too, is the main thing with that is that it causes brain fog and severe fatigue.
Right.
And I had read about the IV drips, about the ozone.
Right.
And I was very interested in that. I read about that people had good results, that it would super oxygenate your blood.
Right.
And it destroys the viral load at that time. It does not cure Epstein-Barr. Right now, they say there's no cure, but you can manage it. You can have some treatment for it. And that's what is available here at Hotze Wellness. There are some treatments that can help bring that, give you a better life if you're dealing with the Epstein-Barr symptoms. But recently, within the last 2 months, I actually called your pharmacist to talk about the y'all were doing the was it the
Peptides.
CBD? No, the CBD.
Right.
And I wanted to find out about that, and that y'all could make different strengths and compound that.
Right.
And so I was interested. Well, actually, one of your techs said, let me let you talk to the pharmacist. You might be interested in low-dose naltrexone. And I have to see, that's one thing people don't understand, too, here at Hotze Wellness. You not only see the physicians, you also have access to people in the pharmacy that are just, even the technicians, the people behind the desk, to the pharmacist, excellent, and your staff over there in the physician's preference.
Right, over in the vitamin store as well.
Yes, the vitamin store as well. So you got everything covered. Well, the pharmacist talked with me, and she said, let me talk with Debbie Janik, and that's
your nurse practitioner.
my nurse practitioner, and she okayed it, and we tried it, and wow, it has lifted the symptoms, the fatigue, and the brain fog that have come with.
It's a great anti-inflammatory low doses.
But it got, I'll tell you what, it's given me I've talked about it before. Whenever you get down and fatigued, your joy goes away.
Right.
And your zest for life. And I have it back. And I'm thrilled. So, life, Dr. Hotze, we go through changes. You get older. I'm 69. I'm not going to hem-haw around about that. But that's how old I am. And so I've been coming here for 20 years. And I've gone through changes during that time. Your body goes through changes. You have different seasons of life, right? That throw your mental state up and down, and your body goes up and down with it as well. But I could always, I tell you what I love, your nursing staff, call them, and they call me back. If they don't answer right away, they call me back that day, and we work something out. We tweak it, we work it. Any of the medications, any of ideas of what could help me, you guys are always available, and I just can't imagine going anywhere else. I can't imagine.
Well, Sherry, we love having you as a guest. You're wonderful, and you've been a wonderful ambassador for us, too. And this is just a great story. And this isn't an exception. We see this commonly at the Hotze Health and Wellness Center. So many people come in to see us really as a last resort. They've tried everything else, and it doesn't work, you know. And I like to remind you of this. Nobody's in charge of your health except you. You're in charge of your health, and you alone. You've got to take charge of it. The government's not in charge of your health. The insurance company's not in charge of your health. Your doctor's not in charge of your health. Your spouse is not in charge of your health. You and you alone have the choice to be in good health or not. And you can make that decision. And for most people, that'll be the most important decision you'll ever make in your life. And Sherry, I want to congratulate you on making that decision 20 years ago, and what a difference it's made in your life and in your family's life, and with your kids. How many grandkids you got now?
7.
Think how much difference that makes now, being healthy as opposed to being sick for the last 20 years.
Exactly. We just went to the lake and celebrated my husband's 70th birthday.
Wow.
And the whole family was there, and we just had a blast. I was able to stay up late and play games and go out on the boat and have a good time, just enjoying my life.
Isn't that wonderful?
Yes.
Well, thank you for giving us the privilege of serving you. And I want to thank each one of you for taking the time to listen to this wonderful story. And I hope it'll give you a tremendous encouragement, because I do believe that you, yes, you, and everyone needs to have a provider and a staff of professionals who can coach you on a path of health and wellness naturally. So as you mature, you got energy, vitality, and you've got enthusiasm for life. And that's what we do here at the Hotze Health and Wellness Center. So don't hesitate to give us a call. We've got our number right there, 281-698-8698. And by the way, I'd love to give you a copy of my book, Hormones, Health, and Happiness. All you got to do is call 281-698-8698. We'll send you that copy free of charge, free shipping. And I'll also send you a copy of the book, Do a 180 and Take a Charge of Your Health. That'll get you on track, get you thinking right. And then once you start thinking right, then you can make some good decisions on how you can get on a path of health and wellness naturally. Thanks so much for joining us today.
A special thanks to Physicians Preference Pharmacy, formerly Hotze Pharmacy, proud sponsor of Dr. Hotze's Wellness Revolution podcast.
Information provided on this radio program is neither intended nor implied to be a substitute for professional medical advice and is not intended to replace the services of a physician, nor does it constitute a doctor-patient relationship. You should not use information from this radio program to diagnose or treat a health problem or disease without consulting with a qualified healthcare provider. If you have or suspect you have an urgent medical problem, promptly contact a professional healthcare provider or call 911. Dr. Hotze's Wellness Revolution radio program advises you to always seek the advice of a physician or other qualified health provider prior to starting any new treatment or with any questions you may have regarding a medical condition. Any application of the recommendations from this radio program is at the listener's discretion.